Would like to welcome everybody. Today our topic is going to be on digital dementia. This is one of the biggest topic and it's affecting our kids right now. So we need to pay close attention how to get the solution to this problem. What is digital dementia? Maybe this is the first time you hear about it and start to Googling it and understand about it. It's a condition of a degenerative brain dysfunction. It's affecting the brain. What happens when you take a look too much time on the screen is not only the posture, the neck is affecting it, it's also a overstimulation of the brain. As a result of overstimulation of the brain, do we have a health issue that's affecting our kids? Okay, so we need to understand it and analyze that. Due to sensory disassociations from sitting in a sanitary posture. So sanitary posture is one of the issues. So now there's more degeneration on the back and the neck, and you see a big pictures on that. With no movement and overwhelming visualized stimulations from the technology. Overstimulation of the technology will affecting the brain. Overstimulations. Sympathetic system on all the time. Sympathetic on all the time will be an issue. Okay, so there's overstimulations of the spine, and then also there's a structural issue leading to pain. Look at these pictures. Normal. This is a normal spine. If it's 0 degree, if it's you're looking at eye level posture, good posture level, is an average weight for the head is 20 to 12 pounds. If you have a 0 degree, the curve is good, no issue at all. But as you tilt this head 15 degree, what does it mean? It adds 27 pounds of weight onto the neck right now. So the neck, all the vertebrae in here, they're increasing the pressure. As the result of increasing both pressure, what does it do? Degenerate the disc. Arthritis of the bone. Okay, so that's one. How about if it's 30 degree? More. Okay. How about 45 degrees? Instead of the neck is weighing 10 pounds, now the neck is weighing 49 pounds. And how about 60 degrees? Now it's weighing 60 pounds. I'm going to go over there and grab a ball and give you an example of this. This is a 4 pounds weight, then this is the weight of the neck, and this is the head, and this is the neck. If I hold it with these positions, it's only 10 pounds. Okay, just pretend this is 10 pounds, so it's only 10 pounds. But if I tilt this ball 15 degree, now the tension of this neck right here is no longer 10 pounds, is what? 27 pounds. Same weight, constant weight, but different angle would produce straining on the neck. So therefore it degenerates. Okay, 30 degrees, now this pound is 40 pounds. 60 degrees is 60 pounds. Oh, it's heavy. So you can do an experiment at home. Holding this positions with the curve or holding with this position, the straining of the muscles is totally different. That's why it degenerates. So I've seen a lot of patients with chronic condition, chronic neck, back pain. Most of my patients that come in here with surgery is C4, C5, C5, C6. Why are there those two area? The disc area has the most degeneration because it takes most loading. Therefore, it degenerates. This is physics right here. This is all physics. Okay? So do you understand the significance of the posture that we're talking about? Not only that, it's also the back too. It's not only the neck, it's the back. So now talk physiology. Talking about physiology, right? Cut down the blood supply. When you do this and take a deep breath in, is that harder or compared to a good posture? And take a deep breath in. Which one is easier? Common sense now we're talking about, right? This will give pressure to the chest, to the lung. Decrease circulation in my carotid artery. Bring more blood, less blood supply to the brain. Does it affect my brain and deprive myself in oxygen and circulation? Normal physiology, common sense physiology. Everyone knows about it, right? So we need to get a solution for this. What are the solution? And I will give you the solution on that. Make sense so far? Now, how does it affecting the brain? How does the brain be part of it? So what's the most important thing that you need to do? What's the most important body part? It's the brain. The brain controls everything. So you have to treat the brain well. Like for my pain patients, what is the first thing that I wanted the patients to do? Treating the brain, taking care of the brain, relaxing the brain. By doing the what? The pump, the exercise that I trademarked. Okay? So the brain has the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. That's called the cortex. That's the cortex. That's the brain, that's the cortex. There's also, this is called the cerebellum right there. So how does the technology, the question is that we're going to ask, how does the technologies affecting the brains, the organs health, and the posture? This is not just the neck problem. It is affecting the brain, leading to dementia. That's why it's digital dementia. Overstimulation of the brain because of the screen. How does it affect, how is the technology affecting the brain, the organs health? How is it related to your organs, right? Posture, lung. How about the rest of your organs? I will show you the significance of the spine, where the nerve travel to the organs. And the posture, correcting the posture. Correcting the posture, start with the foundation. The foundation is always the feet. If you have bad posture, you have to correct the feet first. Okay. How can we do now before it's too late? What can we do now before it's too late? When we know that when there's damage, it's damage. Even though the body can fix it, okay? But it's not as good as before. So we need to understand that. Okay, this is the pictures that I copy. So the children are turning into hunchback. Is that a dangerous sign? It's a very dangerous sign. Our children is our next generations. Okay? Those are guys will be our leaders one of this day. But they need to be healthy. They're being hunchbacked and the brain is not functioning the way it should be. The one thing that I'm very concerning on is a lot of like neurological, like such as depression, anxiety, brain issue, and suicide in teenagers. That's something that I'm very concerning on. And it's happening more and more often now. Do you notice that? Why? We need to help the kids to understand and have the solutions. My story is that I see patients with the most severe neck, back pain. I help patients with the diabetes, Alzheimer's, Parkinson's, okay, to get better. And I focus on more for the seniors, okay. But I see that helping them give me a lot of gratitude because I see them getting better. That other doctor said there's no other solution to. So I have a lot of gratitude seeing those the senior population, and I'm very blessed with that. And then what I need to do is that I need to help the younger generation now. That's why I'm going there and educate the younger and start helping them and start fixing them so they can do better. So I have to start because it's hitting my family as well. My family is affected. Digital, my kids is on it. My daughter is on it. So it's because I make the decision to help, it's because of my daughter. Yeah, and all of a sudden my daughter is 10 years old, and the next thing that we find out, she has a mild scoliosis. And the next thing I see is that she have a flat feet. Flat feet, what does it do? It's going to affect the pelvis. It's going to affect the knee. It's going to affect the pelvis. It's going to affect the spine. So because of her, now I need to, hey, my priority in life is my wife. First is my wife, then my kids. So I need to do something to help my family. Start with my daughter. So that's why I learn more and start fixing it and put a system together. If I can fix the hardest thing to deal with, like severe neck pain, people come in here 2 weeks before surgeries. They schedule surgery 2 weeks and I still get her better. So this thing is easy for me. So I just put the system together and focus is the attention, this is a focus to help them. That's my story, okay? So the first thing, posture, start with the feet first. The foundation. When you want to build something, you always start with the foundation. The first thing that you check is the feet. For my daughter case, the first thing that we have to do is, no matter how much you fix the back or the spine, if your foundation is not strong, is not good, it's going to be all out of place. So the first thing that you need to do is finding is there a problem in the feet, and move it up to the knee, to the pelvis, to the spine, and to the brain. Foundation first. Is that number one rules? 2 things? When you build a house, foundation first, right? No matter how the house is going to be good, if you don't have strong foundation, it will collapse. So foundation first. So how do you check the foundations? There's 5 signs for bad structural feet. Check it. The first thing that you check is what? It's your feet. It's the foot flare. Do your foot tilted to one side? Just close your eye and take a couple of steps and stop. Look at your feet. If it's straight, it's good. If it's tilted like this, check your feet. Foot flare. The second thing is the internal knee rotations. Right here here's the pictures. When you draw a line, it should be a line straight, or if it's tilted in. There's an issue right there. It's tilted in. Internal rotation of the knee. Okay? So you look at the knee and relative to the feet. So we would check that. The third thing is that take a look at the Achilles tendon. Do you see the Achilles tendon being bolted? If you do, fix the feet. Flat foot, okay? So the arch of the foot, right? Look at the arch of the foot. Everyone knows about that. Look at the arch. And then when you stand, check to see if there's an arch. If you don't have an arch, that's a problem. That's what happened to my daughter. Her feet is flat when she stands. When she sits, there's an arch. But when she stands, doesn't have an arch. And then also, take a look at your old shoes. Take a look at the old shoes to see if there's uneven wear. Usually, most of the time, I've seen that there's a wear and tear on one of the side. Okay, so take a look at that's the foundation, right? Check the feet. Second, check the posture. The spine. The spine, the lower back has to have a lordosis, right? And then also the neck. Why is there most loading on the L4, L5? Because posture. This puts a lot more pressure on the disc. So what do? You sit up straight and do the pump every 30 minutes. Okay? Do the 2 pumps. I keep saying do the 2 pumps. That's the exercise that I trademark. Exercise with a thought. Okay, the 2 pumps. So do the exercise. The spinal posture, right? You have to have a good posture. And then how does it affecting your organs? Does your posture, does your bad spine affecting your organs? Do you know, anyone knows? Will it? Will it affect your organs? I just given an example, right? Bad posture, lung issue. Compressed. Okay? Take a look at this. The spine. Where's the nerve goes to? To the spine, into the organs. If there's a problem in the spine, does it affect the organs? It's science right here. There's research on this topic. Okay, so it's common sense. Problem with the spine, we're affecting the organs. Okay, and then also that's why I said keep saying the 2 pump, the 2 pump, the 2 pump, the 2 pump. Where's the exercise with a thought? The 2 pumps. Where does 2 pumps come from? One pump, two pumps. Where are those two pumps for? The lordosis curve, giving the curve back, pumping the disc, pumping the spinal cord. And take a look at this. This is blue, blue and yellow, 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 and blue. What's blue? Is the parasympathetic nervous system. Is the calming down nerve. The sympathetic nervous system is the exciting nerve. Okay? So one is excited. Stimulation, what happened? It will turn this guy on all the time. Overstimulation is going to be sympathetic overload. Most of us are sympathetic overload right now. So what we need to do is that we need to calm it down with the parasympathetic nervous system. So breathing is parasympathetic nervous system. Gargling is parasympathetic nervous system. The best to stimulate the parasympathetic nervous system is the gag reflex. So what I do when I brush my teeth, I should give myself two or three gag every brush. Okay, so you stimulate my parasympathetic nervous system. See that? Pictures? It's a feedback mechanism. Now it's the brain. I will spend more time because people doesn't understand. Anything, your body is a unit. It's a unit. Anything happen in the feet, does it affect the brain? Yes. If you have back pain, does it affect the brain? Yeah? So if you have leg pain, usually the same side, like patient with low back pain going down to the leg, next thing is going to be the hands. The coordination of this hand is going to be not as good. Usually. Why is that? Because the bombardment, same size, right? And then the left brain. If you have a right side of the body issue, is the left brain. Make sense? Right side of the body, left brain. The brain. So this is called a posture neurology. So what we need to do is that we need to analyzing the brain. So the brain is the what we call is the cortex. The cortex has the frontal lobes, parietal lobe, temporal lobe, occipital lobe. That's the cortex. This is the lobes of the in the brain. So we need to check that. We need to check the cerebellum. Cerebellum. What's that? That's the posture. That's controlling the posture muscles. Okay. So what happens if you are? Most of us are in which position? Fighting position. What's fighting position? Sympathetic on. You see that? When you fight, right? When you're doing the video games, computers, iPhone, you're bending. You always say sympathetic what? On or off? On. Sympathetic on. Most of the time it's on. Okay? Because it's contracting. The neck is contracting. The posture is contracting. All this is sympathetic on. So what you need to do? We need to relax it by doing the pump. And also cerebellum. There's one test. I always, the vibration test. I test on the feet. Oh, you lose sensation. The next thing I said, you have a balance problem. For my neuropathy, they understand. They said, I don't have any balance problem. I said, we will check. Most of the patients said, I don't have a balance problem. When I said, oh, they lose 50% of the sensation on vibration. Balance, right? So vibration test the posterior, the cortex cerebellum, balance. Okay? So, and also the midbrain, the cranial nerve, right? The eye movement tests most of the cranial nerve and the locations where the problem is coming from, and also the spinal pathway, the spine. If there's any misalignment, it's going to affect the nerve to the organs on the spine. So we want the spine to be aligned correctly. Just review, this is the brain, that's the lobe, and this is the cerebellum. The cortex. The cortex is the lobes that we were talking about, the frontal, parietal, temporal lobes, occipital lobes, okay? So what's the function of that? Is for sensory and motor. What sensory means? Feeling it. Tingling, numbness, right? The sensation that you feel, it's sensory. How do you feel the world? It's the sensation to interpret the world, your world. That's sensory. Motor is to move within that world, so the movement. So the cortex has those sensory and motor. We will test those sensory and motor during the neurological exam. The cerebellum, this part right here, this is the cortex, okay? The frontal, the occipital, temporal lobes, parietal lobes. And then this is the cerebellum. Cerebellum is very important for the posture. It's your system for checks and balance. It coordinates and refines the movement pattern. Okay, so we will check the cerebellum. So one of the way that I check it is, so you can check it at home too. Feet together, look straight, arms out like this, close your eye, and try to touch the tip of your nose and see. Some patients, if they have overstimulation, even kids, they can start doing this now. Or they try to do this very quickly. No, do it slow. Okay? You have to do it slow and see if you can touch the tip of your nose. Okay, if you're not, we need to further investigate. Check the cerebellum. The cerebellum to influence the function of the brain. So remember, the balance is the brain. And then right here is called the brain stem. The brain stem is the midbrain, pons, and medulla. So how do we check that? Cranial nerve, eye movement. We just scan at the eye movement. We will see if there's any issue on the midbrain, pons, and medulla. Cranial nerve 9. Check the neck. What's the neck's muscles? Trap muscles and SCM is spinal accessory nerve. That's one of the cranial nerve 11. Okay, so that's why we know if your neck is tight, the location is going to be around the medulla area. So loosen it up during the pump, relax it. The cranial nerve. So that's how we check this. The spinal, make sure the spine is straight, correct, no misalignment. That's why when we work on the patients along the spine, do they feel good? Along the spine, they feel really good because what we do is the intention of the doctors is important. Increase circulations, lymphatic drainage for the patients to increasing the lymphatic drainage, increasing blood supply to that area. So that's why when we work on the spine, we feel so good. So the spinal nerve has sensory, motor, and integrations. So if you know what control the posture and understand what's the input to the body, so posture is important. Fixing the posture correction. If there's an issue, fix it, and it's also helps you fix the brain. And we can directly influence the posture and the function, and it does not have to be very complicated. It's simple. It's very simple. We need to analyzing it, where is the problem coming from, and start fixing it. Analyze the brain function in relationship to the posture. Balance the posture. Don't do this. Sympathetic on. Fixing the posture is important. Remember, fixing the posture means fixing the brain. Know which area of the brain are weak. We need to know which brain area is weak. So we're doing the neurological tests on the patient. We scan it and see if there's an issue. Then what do? We have a plan to fix it. How to retrain certain part of the brain. Remember, we can retrain the arms for the brain. Eye movement for the brain. One thing, I just throw it out right now. The eye movement, okay? So can I train the eye movement to help you to correct the posture? Just give you an example. This is called POS, okay? So what it does is that your posture, right? What does the eye always want to do when you look down? You look down. The eye always looking down, right? Most of the time, what do? Sympathetic on, muscle contracted, right? So what do we have to do? Look eye level, but look up. That's why during the pump, what did I tell the patients to do? Roll your eye upward and back. So there's way that we help to release the tension of the posture by exercising the eyes. When you exercise the eyes, you loosen up the muscles. Okay, I have patients with pain. I give them the eye exercise movement. It will help to reducing the pain because it relaxing the muscle by training the brain. That's an example. The eye move training the brain will help the posture. Training the coordination of the cerebellum will help the posture. Make sense? Knowing where the weakness is and how to target the weakness. So we need to do an exam and how can we fix it. How to exam? So the first thing that we do to exam is from the foundation up. Okay, so we're going to do the computerized posture analysis. So we're going to take the pictures from the feet on up and check the posture from the front and the side. Okay, on the front, what we're looking at is your ear level or not, is your shoulder level or not, if your pelvis level or not. It's sympathetic on sign. Okay, so what's sympathetic on? We need to fix it. Okay, on the side, ear, shoulders, hip, and the feet, are they aligned? If it's not aligned, if it's tilted 1 inch forward, what is it equivalent to? Remember that? The angle of movement, 1 inch of anterior movement, put a lot of strain on the neck. So we need to do, has a computerized posture analysis, and then also a computerized feet analysis. If you do have those 5 signs that we mentioned earlier, okay, then we would want to check the feet to see if it's overpronation, like means that there's a feet issue, okay? And we have a computer analyzing to check that. And then also the we also check the spine, checking the location of the pain, and then also analyzing the brain scan. Okay, so we're going to test the brain from the cortex, which is the cortex, the cerebellum, the midbrain, and the spinal pathway. So those are the spinal scan that we do. So my offer is a consultations, a computerized exam on the posture, and also analyzing on the feet. It is like $325. So what I'm offering is for $47. Okay, it's for the complete exam, postural exam, brain scan exam. And I'm very selective in the patient that I see, because I told the patient, I can teach you, I can educate you, but I cannot do it for you. So you have to do it. You have to take action for this. Who is the only person that you can fix it? It's you. My job is to give you the knowledge, give you a system of doing things. So you have to act upon it to get the results. So you have to take the actions. So you have to do the work. So patients come in here, I don't accept everybody. So I don't want headaches. I only accept the patient that really want to get better and willing to get better and willing to learn to get better. So those are the people that will have the best results. If the patient saying that, oh, I want you to do everything for me, that's not the right fit for us. Okay, you have to do the work in order for your health to be better. And thank you. And that's my presentation for today.